Good morning, everyone. I am Dr. Carr, and I'd like to welcome you to Mrs. Peters' Care Conference. Thank you, everyone, for making yourselves available today. I think we've all had a chance to meet Mrs. Peter, and we're up to speed on her condition. Part of the reason that we are here this morning is to give Jennifer the opportunity to voice some of her concerns about her mother's care. I think we should start off with introducing ourselves at the table.
My name is Callie, and I'm the dietitian on staff here.
My name is Lauren, and I'm the LPN.
I'm Jennifer, and I'm just disgusted with the care that she's receiving here. While at KGH, there was no issue or problems, and now that she's here, the problems are endless. She's crying all the time, she's withdrawn, she's upset, she doesn't sleep, she's got a bad mood, and to top it off, 2 bladder infections, and constipation, and now enemas.
So just to make sure that I'm hearing you correct, you feel that your mother isn't receiving adequate care here in our facility, and that you are shocked at the multiple other health concerns that have arisen since her admission.
Yeah, plus I'm pissed. No one will tell me anything. I'm watching my mother get worse and worse every day, and I'm sick and tired of it, and nobody's communicating with me. She is my mother.
Sounds like you're frustrated and very upset, and feel that we have not informed you about your mother's condition. Am I understanding you correctly?
Yes, and your staff are stupid. They don't know anything. I have half the mind to sue your facility.
Okay, I hear what you're saying. However, your tone is not appropriate and will not facilitate a solution. Let's keep this professional so we can focus on the changes you want to see in your mother's care.
Okay, I'm sorry.
So what changes would you like to see?
Well, I would like to know what's going on with my mother on a regular basis. I don't want to walk in here and be surprised. I would like a mental health assessment for crying and agitation and withdrawal. And I also want the same type of care that she got at KGH to be here as well. Simple enough?
Yep, I just want to make sure that we're all on the same page. You want regular updates on your mother's condition. You would like also to have a mental assessment to help understand why she is crying, agitated, and withdrawn. And you want her care to be at the same level as it was at KGH. Is this correct?
Yeah, that sounds reasonable. How are these updates going to happen, and who's giving them to me? While we're at KGH, the doctor mentioned mental health assessment, and that I could get one here in this facility.
Well, since you're in to visit your mother multiple times a week, we can arrange to have face-to-face updates as needed. I can also make sure that you are contacted immediately if anything changes in your mother's condition.
Thank you for that. I guess I'm just overwhelmed with all these new changes, and I feel like when I walk in here, it's always something else. I really don't need minute-to-minute updates. I just don't want any surprises.
Carr, would you like to weigh in on the mental health assessment?
Yes, Jen, we do have a geriatric psych team on site, and if you're in support of it, I can submit a referral in regards to your mother's changing behavior.
Yeah, I think a referral would be helpful. Thank you. But what about our personal care?
In regards to your mother's conditions, I think an assessment would be helpful to ensure your mother is receiving adequate dietary needs.
Yeah, I agree.
So just to review and ensure that we have covered all the material, I want to confirm that the plans on your mother's personal care. I would like to create a care plan that has your mother on a toileting routine to help ensure her personal care is consistent and further understand what needs she needs for toileting purposes. Is there anything else?
No, that all sounds reasonable.
I will make sure you have all the pertinent information as well as any follow-up numbers. Thank you for meeting with us again and sharing your concerns and perspective. In 2 days, I will have her care plan done and we can meet to review it. Please feel free to call anytime.
Jen, I think it's important to include your mother in this conversation, so I'd like to go see her now. Would you like to join me?
Yes, I would. Thank you all for meeting.
Allison, Karen, thank you both for being here today. We all play an important role here on the unit. In order to be an effective team member, we need to be able to set aside our differences. I understand that there has been some tension between the night and day staff. The purpose of today's meeting is to set a venue that remains confidential, meaning what happens here stays here. I encourage you both to voice your concerns in a professional manner so we can resolve this conflict peacefully. Do you both agree with this?
Yes.
Yes.
Just to start our discussion, I would like to give each of you an opportunity to explain your perspective in regards to night and day staff. Who would like to go first?
Yeah, I'll go first.
Allison, is that okay with you?
That's
I
okay.
just get so pissed off when I show up to work and nothing's been done. I have a mess to clean up on every patient and it gets worse and worse. And it happens each day. soaked and there's crap everywhere. There's red sores, and we all have a job to do, but why is the night shift not doing it?
Let me know if I understand you correctly. It seems as though you are frustrated with the night staff and are concerned that all duties are not being completed before shift ends. Is that right?
Yes.
Yes. Allison, would you like to share your perspective?
Yeah, I'm not the only person working nights. You know, I feel as though I'm being singled out. I do my rounds and my turns, and if a client needs extra attention, she'll be brought up in report. And I don't think Karen should be pointing fingers.
All right. Yes, I agree. Finger pointing is counterproductive, but I need you both to work together as a team to resolve this problem. All right? Yeah? Okay. So let me just understand. Your concern is that you feel you're being singled out, even though you do your job and clients that need extra attention should be brought up in a report.
Yes.
That's right?
Yeah.
Okay, let me just take a step back and make sure that I have all the information. It seems like the day shift is frustrated with the night shift and concerned that all duties are not being completed before the shift is over. Night shift, as far as you know, Allison, you are doing all of your duties, but you cannot speak on behalf of the other members of your team. If clients do need extra attention, this should be brought up in the report. Is this right with both of you?
Yes.
Yep.
Yeah? And how would each of you like this to be resolved?
I want everyone to be responsible for their own duties.
I agree. It's a team responsibility, not individuals.
Okay, so now that I have both of your ideas, how about you come up with a shift duties list to follow to keep everyone on the same page? Does that sound okay with you guys?
Yeah.
Have your list back to me within 3 days, and during report, these duties will be made aware for each shift to follow, making sure that each team is responsible to complete their duties. After 1 week, we can reevaluate and see how things are progressing. How does that sound?
Sounds good to me.
It's perfect.
And what can we do to prevent this issue from happening again?
Maybe we could talk to the LPN shift supervisor about the duties not being completed, so we're not pointing fingers.
Karen, do you agree with this?
Yes.
So, if this does not work well, what will happen?
We could implement a service about teamwork and how being part of a team means cohesiveness.
I agree, that sounds good.
All right, great ideas, ladies. Let's plan to meet next week to reevaluate. Thank you for meeting me today, and please let me know if any other questions or concerns come up.
Okay.
Take two.
Good morning, everyone. I am Dr. Carr. No, it was Lauren this time. Thank everyone for making themselves available to come today.
No, it's fine. Lauren was being a shithead.
No, I lost my train of thought.
I looked at Lauren and she was like...
I gotta cross these lines.
Because you stared at me. You're like, how did you do it?
Take 10.
Yeah.
We were so close!
That's okay.
And I feel like I should be facing... Callie, just get out of the scene.
And I'm Jennifer, and I'm just pissed because the care of the... That's how bad I am!
Should have just gone with that.
If I could have maintained...
We have this fucking part down pat. Good morning, everyone. I am Dr. Carr.
Come on!
It was the...
Relax those cheek muscles. Yeah.
We can implement an in-service about teamwork and how important being a part of a team means cohesiveness.
You want to try that line again?